it is my pleasure to give you a quick overview of what we know about the fairly newly named COVID-19 novel coronavirus. And the first thing I want to say is, as is always true with something that we've never seen before, it, of course, triggers a higher degree of interest and concern from all of us. And we in public health are always careful to say, we will tell you what we know when we know it, and we will always say, but we can't predict exactly what's going to happen with a novel virus that's previously been unseen. But obviously, this has been really significant global news in the U.S. and here in Minnesota since late December or early January, when the rest of the world became aware of it. I'm going to talk about COVID-19 first, and then give you the influenza update. It's an interesting kind of contrast between something very familiar to us and the public health significance of that, and the new concerns around COVID-19. So these numbers literally change several times a day. So since this slide was produced this morning, there are now 73,000 cases globally of COVID-19 and 1,875 deaths. At least that was as of a few hours ago. It's very notable that of the 25 countries reporting any cases at all, the vast majority of the cases and almost all of the deaths have been in China, and Hubei province as the epicenter, as we all know. Only 15 cases so far have been confirmed in the United States. We do know that some of the passengers on that very unfortunate cruise ship, the Diamond Princess, are Americans and are being brought back to the U.S. over the coming days. Those who are symptomatic will be taken directly to medical facilities. Those who are not symptomatic will be quarantined at bases, so they will not be coming directly back to any states that aren't already set up for these sort of large-scale quarantine efforts that we've seen with repatriated Americans coming back from China in recent weeks. So we do expect these numbers to continue to change, but it is notable that there just has not been widespread increases in these numbers, not only not in the U.S., but in most of the other countries reporting. What it appears about COVID-19 from how easy is it to spread and how dangerous is it, is that some of what we know from the other coronaviruses that have been circulating, this appears to be, at this point in time, actually less lethal than SARS and MERS. And that's a good thing. And it looks to be not too dissimilar from the flu in terms of its lethality. Might be a little bit easier to spread than SARS and MERS, although that's still a really rapidly emerging picture based on more and more reporting coming out of China. We do know that, as is true with most of the other respiratory viruses in the coronavirus family, those folks with underlying medical conditions and older adults seem to be more susceptible to having a more severe case of COVID-19. But always, and we know this from the flu as well, occasionally there will be a perfectly healthy person that has a very serious reaction to COVID-19. So it's not it's just never the case that a blanket statement can cover all contingencies. So as I mentioned, there are no confirmed cases in Minnesota and have been none since the outbreak began. We have had a few potential cases that we have shared samples with the CDC, 3 to be specific, and those all came back negative for the COVID-19 virus. So no confirmed cases in Minnesota. The health department and our partners are working hard to get information out to all the partners in the public health response effort, including the hospitals and health systems from whom you'll hear directly. But it's very important to us that we're communicating accurately and frequently with local public health agencies, with our provider community, particularly with Chinese Minnesota groups, with folks at the University of Minnesota and other institutions of higher learning that have potentially large cohorts of Chinese students and staff. Our Minnesota international corporations that have folks traveling all over the world and relationships with China. As well, K-12 schools are asking for an increased level of information, as they just want to be sure that they're prepared should there be cases in Minnesota. So we're in constant contact, literally multiple times a day, with lots of different stakeholders. We do continue to get a lot of calls every day from providers and from the public, people with respiratory symptoms and any history of any travel anywhere. Folks are understandably concerned just that this virus might be present wherever they've been. Most typically, and certainly that's part of what makes this difficult, is with the amount of other respiratory illness circulating in our community and circulating globally, it can be hard for people to distinguish between symptoms of the flu or other common respiratory illnesses and the new COVID-19, which is why at this point in time the only definitive way to rule out whether something is another respiratory illness or this virus is for that specific lab test that's been developed rather remarkably quickly by the CDC with the genetic sequencing that they have had from the virus itself. To this point in time, only the CDC has been able to do those lab tests. We have, at the Minnesota Department of Health and other state public health labs, also been given test kits to test for this virus, although there was an issue with one of the reagents in the first test kit. So we are not yet doing the testing here in Minnesota, but we will be I anticipate the very near future. In addition to the cases we know of and the quarantine that happened with the Americans that were repatriated from China, all air travelers from China are now going through 11 screening airports. Ours is not one of them at MSP. And all travelers from Hubei automatically go to a quarantine location for 14 days. Travelers from other locations in China are asked to self-quarantine for 14 days. And health officials are given information on any recently arrived travelers who are not going to quarantine. So there are folks, Minnesotans or visitors to Minnesota coming here from other locations in China who are in this self-monitoring status. We are given daily lists of passengers who are arriving for us to be in contact with. So we know who's in this situation. We give them information on what to monitor. We're in touch with them a couple of times a day about emergence of any symptoms or not. So it's a pretty robust surveillance effort that we have. And in addition to these activities that are targeted specifically at travelers from China and elsewhere, just one of the real strengths of our public health system in Minnesota is the really good surveillance network that we've established with our healthcare providers all over the state. Our infectious disease reporting laws serve us well. Our partnerships with the provider community serve us well, that folks don't hesitate to call if they are having questions or concerns about symptoms. So we really rely on that system that's functioning 24/7 all the time. There are interesting diseases reported to us on a daily basis. This is something we do literally every day. Not always with a novel virus that's never been seen before, but we really do feel that we've got a very, very strong surveillance system in place. So the protective recommendations for the public from the CDC are really the basics. It's just exactly, if one's worried about protecting themselves from COVID-19, it's really the same good old standard precautions that are advised for any respiratory infection, that it's very helpful to protect yourself and others to stay home when you're sick. Always cover your cough and wash your hands really well, by which we mean really, really well. I watched a video the other day of proper hand washing technique and realized that I could buff up my technique a little bit too. You're really supposed to wash very thoroughly, nails included, and it's very, perhaps the best single thing we can do. We at the health department do periodically take a look at whether it is appropriate to recommend, and groups are often asking us, several groups have asked us, should we cancel this or that event? It is at this point, we are not making any recommendation that there's any need to cancel community events, whether that's in the Chinese American community or anywhere else, that we have no indication of a virus circulating here that would lead us to recommend cancellation of events. We absolutely do continue to monitor the situation. There are literally multiple calls every day between the CDC and our epidemiologists, and at least 4 briefings a week with state health officers. So there's a constant stream of information flowing, and we absolutely commit to you and to the public that we will share new information whenever and as soon as we get it. So one question we've gotten is, what about face masks? Should we all be wearing face masks? And really, the best use of face masks are by ill people to prevent them from spreading the infection, and by healthcare workers who are providing direct care. For the rest of us, face masks are not recommended as a preventive measure. And actually, we're beginning to get a little concerned about the supplies of these kinds of personal protective equipment. So any stockpiling or attempts for people to kind of gather these things and save them do raise potential concerns about the availability for those who truly need the masks. So again, another reason why we want to assure the general public that we don't all need to be wearing masks.